because I'm not showing any pictures today. This is a half-hour express meeting, so we're going to get right to it. As always, we're pleased to all be together with you here today. We will talk about our COVID testing data just very briefly, then spending most of our time on the FAQ document that we just recently released, and then just making sure that you know about a resource that came from the American Association of School Superintendents. So just a quick update on COVID testing. We are just pleased to see the results continuing to come in as we close out this school year, and in particular, that the pool positivity rate continues to go down. And that's just good news as we look ahead to the summer. But like I said, the main event for today is the FAQ that we released on June 9th. And we're just pleased to tell you a little bit more about it. In a second, I'm going to switch screens or switch views so that we go into the document itself. But just to, if you haven't had a chance to take a look at it yet, we got a lot of good questions after we released our information about testing for the for the spring, summer, and fall. And based on those questions, we are responding to you in writing through the FAQ. So the types of things you're going to find in the FAQ is information about school-based summer programs, consenting, what does it mean to have consent for the summer testing, how you can obtain a summary of all individuals that have consented to your testing program during this school year, and what to do with expired or expiring Binax Now and iHealth tests. So that's the first thing actually in the FAQ. I'll be glad to share that with you in just a minute. If you have questions, if you've seen the FAQ and you came today with some questions that you want to make sure we get to, just make sure you put them in the Q&A of today's webinar, and I'm galloping along right now because we want to make sure we get to your questions during this half-hour time together. So also there's information in the FAQ about, again, the summer requirements for symptomatic testing, and then what you would need to have in place, particularly as it relates to Clia waivers. That was a key thing that we heard from you a lot about, in addition to the provider's order, the standing order that you have in place. So without any further ado, I just want to get into it. And one of the key pieces, again, is that Clia waiver. And you asked a lot of great questions about how schools and districts should be thinking about Clia for the summer and for the new school year. So we created a chart, and I'm going to show it to you again in the FAQ in just a second. But I think this is one of the most important things to know as you're going forward, because applying for Clia is important, and knowing when you need to apply will be very, very important as you move ahead. So Lauren, correct me if I'm wrong, but the Clia waivers that schools have in place right now for conducting in-school symptomatic testing, it will cover all of our schools through the summer.
That is correct. And it will, it covers schools for the use of any in-school testing. So if that means that you're using any leftover Binax Now testing that you might have, or if you're using the self-tests in school, if you're administering them in school for any reason, particularly symptomatic testing, the Clia now covers that through the summer.
And so there are kind of two considerations with Clia. When is Clia necessary? What are the requirements where Clia needs to be used, where you have to have the application completed and confirmed, or and then when will you need it? So let's just start with the types of situations, and then the FAQ that I'll show you in just a minute gets more into those, into looking ahead to the fall, the when you might need Clia for yourself. So this table kind of has bookends on it. We've got the any time where a staff or some other third party, somebody external to the student or their family is actually taking the test or conducting the test, and sort of overseeing the student taking their test. If staff are involved, that's really kind of what you have in this top box and in the bottom box. So if Binax Now Professional, the professional version is used for point of care testing, that you've got, professional staff member involved in conducting a Binax Now in school, Clia is necessary. Similarly, if a self-test is conducted in school and performed, or the results are interpreted by a third party for any reason, if a staff member is using a self-test in school, then Clia is necessary. But if the tests are just sent home, then Clia is not needed. So if you're thinking ahead to the fall and you're planning that, you have to just be thinking about, are we going to be conducting tests in school or are we going to be sending tests home? I think is a key distinction as to whether or not Clia is necessary. And then also if a student, for example, at a high school level, if students conducted their own self-tests in school, not administered by staff, then you wouldn't need Clia, and you see that across the board in terms of both the needing Clia, reporting the positive results to DPH, and whether or not a provider's order is necessary. So we just try to break it out into, just thinking about the type of testing program that you'll be running in the fall. How much will you rely on in-school testing with your own staff? Will you be bringing in contracted staff? And if they're performing those tests, then just thinking ahead that you will need Clia, you will need a provider's order, you will need to report positive results to DPH. And conversely, if the whole thing is done by individuals, either at home or in school themselves, then Clia is not necessary. And I realize that, you might have most of your students being able to take tests on their own, but you might have some students who can't, even in a high school. And so just looking at all contingencies, I think will be important as we move ahead. But let me stop my sharing real quick and move over to and keep it on screen too. Hold on, bear with me. You would think I could be faster at this. All right, I've got the FAQ. Lauren, are we seeing the FAQ?
Yes, we are.
All right. So just to start with, it's really important as we move ahead with the tests that you've received from us that we're paying close attention, as always, to expiration dates. And what we see with a lot of these self-tests is that their expiration date keeps getting extended, and it's valid, it's appropriate, it's legitimate. And we just don't want there to be any confusion about that, because if you only go by the date that's printed on the box, it could raise some concern, some alarm. We had that happen in the school year when the tests, in fact, have not actually expired. It's just by, common sense. You take a look at a box, there's a date on it that looks like it's expired. The first thing most people would say to themselves is, it looks like this test has expired, not we should go check the list that's on, various websites, including DESE's website, to see if that is in fact the truth or not. So to make this easier for you, we are including with the shipments that we've made most recently, any shipments that you have, particularly for tests you'll use this summer. So the orders that you put in on June 1st that you've now received, you should also see that you got a packet of stickers, and the stickers have information about the expiration date, the extended expiration date, so that you can put that sticker right on each box and cut down on any of that consternation. Because I can only imagine, as you're sending these boxes home, we just don't want families to be coming back at you with questions or concerns, or staff coming back at you with questions or concerns about expired tests that really haven't expired. And so we hope that sticker just takes away the concern and any consternation. Also note that the stickers have treatment options that could be available for some individuals, particularly based on age of the individual. So, we were trying to respond to the "you get a positive result, now what?" question that has come up as well on the individual level. Jeremiah, anything else that you want to say about the stickers? Oh, you can't unmute. I'll make you co-host. All right, you should be okay now.
Thank you. You're right. Although embarrassingly, no, I have nothing else to say about the stickers. Thank you, Russell.
No, that's quite all right. And I think one thing about the stickers is that, we couldn't match the stickers with each box. We do need you to do that. So as you are kind of handing them out, just making sure that you're putting that sticker, some staff member is affixing that sticker on the box as it goes out, which will be really important.
And actually, Russell, I'm so sorry. I do have just one thing. Folks, please slap those stickers on the front of the box. I can't believe I don't have a box in my office, but you might know by sight, the back of the box has a lot of instructions, and I know most people know how these work by this point, but if we can just slap the stickers on the front of the box and then make sure that all the text on the back is legible. Thank you.
Great. Thanks, Jeremiah. So again, just like I mentioned just previously, the same information that I just shared with you about when Clia is needed, when reporting to DPH is needed, when the provider's order is needed, based on the situations, are are all included in the same table that's that I just showed in the PowerPoint and is also available here. Lauren, do you want to jump in?
I was just going to ask you, Russell, if you could just zoom in on the document a little bit. People are.
Sure. Not a problem. How's that? Great. Excellent. So we hope that that's helpful just as you're thinking through how you're administering. So like we mentioned, the Clia waiver is still good. The Clia waiver that you've been operating on all this school year remains in place for the summer. So that's written here and very important. Except that if you are a school that's new to the program. So remember, Clia is for every school. So if you had a site that didn't operate a testing program during the school year, Clia is site specific. So if through the moving around of programs in the summer, if you have a site that didn't offer testing during the school year, was not included on that form that you filled out for us a long time ago, you might not even exactly remember it. But if you did submit a Clia waiver previously, those schools are covered, those sites are covered. But if you have a new school coming online for this summer, then you will need to fill out the survey that is the application for a Clia waiver. And then really importantly right here, for the start of the new school year, that Clia waiver will not be applicable. So let's just, making sure that you see that this survey is to be part of the current model that we have for the Clia waiver. As we look ahead to the new school year, each site would likely need to get their own Clia waiver. I think that comes up down below a little bit more. So maybe I'll just get to that at the end as well. And the provider's order that we have in place right now also runs through the summer. So you wouldn't need to get a new provider's order for the summer. And if you just put your questions into the Q&A, we'll make sure that we get to you. So again, I'll just keep moving along. And we talked a little bit above about reporting results to DPH. And so just want to point out that that information is available here as part of question 5. And Jeremiah, we talk in the FAQ about using simple report. Do you want to say anything more about the use of simple report and maybe?
Yes, thank you, Russell. I have 2 things here. The first is I think I saw a question in the chat, I'm just trying to keep up, about whether you needed to set that up on a school level basis or a district level basis. That's up to you. If I was running a school district, and I'm not, but if I was running a school district, I would probably set it up on a district basis, just because it's gonna kind of give you some administrator oversight. But there's no problem if you want to sign that up on a school by school basis. That's up to you. And the other thing that I do want to make sure that folks understand is this is explicit here, but just being very loud about it, because I know that reporting negatives was a lot of work for folks this year. You no longer need to report negative antigen results, period, to DPH. So no matter the kind of test or where it was performed or who performed it, if you have a negative antigen test, you do not need to report it to DPH. This is only for the positive results. And only for the positive results that were, again, administered by a staff member at school.
Great. Thanks, Jeremiah. And so you'll also find in the FAQ lots of information about how to sign up for Simple Report and the steps to take to set up your organization. So I hope that's helpful as well. Very importantly, we received the question after the webinar that we had a few weeks ago about consent forms. And I received a good suggestion and we followed up on it. And the suggestion was that why is it that students who already consented during the school year wouldn't be covered during the summer? Because previously I had said that the consent form ended at the end of this school year and you would need a new consent form for the summer. We talked about it with our legal advisors at our respective agencies and confirmed that, in fact, we don't need to have new consent forms for individuals who had already consented during the school year. So if a student received COVID testing during the school year, they can continue to do so during the summer. That's, I think, great news. It will really cut down on any of the work that you need to do to get ready for the summer. So we want to really importantly bring that to you right now. But I went ahead and bolded and underlined that if you have individuals who are new to testing this summer, so a student moves into your school or district for this summer, they're new to you and you don't have consent already on file, you would have to go out and get consent for those individuals. And you will need new consent forms for any testing that you run in the fall. We were asked if what information needs to be included on a consent form. And so just notice that this is highlighted here because if, like Jeremiah was saying, if you run your own testing in school and it's administered by a staff member, either your own or contracted staff member, positive results do have to be reported to DPH. And so we wanted to make sure that you have all the demographic information that you will need in order to report those positive results. And so that we just double check this, make sure that this is the information that as you design your own consent form, just make sure you include this information there as well. There's lots of other information in the FAQ. I would encourage you to take a look, but a really important thing, like I was saying before, is, what do you need to have in place for your fall program, and how does Clia relate to that? What do you need to have a Clia waiver for the fall? We need to make sure that if you are going to run your own testing program in the fall, that you submit your Clia waiver as soon as possible. And we would encourage you no later than August 1st, because we would like you to have a seamless start to the new school year. So as you're kind of winding down, if you have staff, I know that there's a lot to get done in these last few days of school while you still have staff, available. Could be a good idea to do it now, and to be thinking ahead, because if you want to begin testing, late August, early September, you really have to have that Clia waiver in place in order to do that. And maybe you would get started just with sending test kits home if you're running a testing program until you get the Clia waiver, but you can prevent that and any, potential fallout locally. If you're, kind of saying we're going to run a testing program, just make sure you take the steps to have it ready, and particularly this Clia waiver piece. So we do have information in here about that process. Lauren, anything more that you would say about the steps districts need to take to be ready for the fall with a Clia waiver?
Nope, the application instructions are right here in the FAQ, so we encourage you to follow them. And really that August 1 date is just so that you're able to start the school year under the umbrella of your own Clia. You may submit one application and list all of their testing sites within that one application. The fee is only $180, so we hope manageable for all schools and districts. But we definitely encourage you to submit as soon as possible so that you're fully covered at the start of the year. We cannot guarantee that if submissions come after August 1st, that they will be processed in time for the start of the school year.
Thanks.
Jeremiah, anything else?
Yeah, just frankly, I know that folks are very busy right now trying to wrap up. If there's a way to carve out 20 minutes to just get this in now, I think it's going to be a lot more painless. Like a small time investment now for a large time return later, because there are going to be a lot of these coming in July. If you can do it, please do it now.
Yeah, absolutely. And I think that we felt really strongly about getting this information to you now so that you can make that decision to get it done. And we just want to avoid any additional stress as we start a new school year. Lauren, do you want to just mention anything about the model provider order?
Yep. So any test that's run in school by your school staff needs to be done under a provider's order. The provider's order that you've been operating under for the SY22 school year, again, like Russell said, will be extended through the summer. And so you do not need to obtain one for any summer testing. However, you do need to have your own provider's order for any SY23 testing. So for the start of this upcoming school year. And in the appendix of this FAQ, so Russell, if you want to scroll down, we have provided sample text for what you could send to your either MD or, I don't want to misspeak on this, Jeremiah, but who can sign the provider's order? Can a nurse practitioner sign it or just MD?
Yes, nope, a nurse practitioner. Okay,
so nurse practitioner or MD who's working with your school or district. And so we have language in there that you could use if you want to use our template for next year's testing.
Thanks, Lauren. The final thing just to mention, and then glad to go to your questions for about 10 minutes, is there have been questions about how can you get information about who participated in the testing program this year and who had consented for the testing program. So CIC has can give you a downloadable list. And so we have detailed directions and a link here in this document about how you can download that summary of individuals who consented to testing for your school or district during this school year. Keep in mind that this is only available throughout this summer. So, our contract with CIC is coming to an end. We really appreciate that they are continuing to make this information available through the summer. But as we start the new school year, the links will not work anymore. So if you feel strongly that you need this information, that you need that downloaded list of who had consented, would also encourage you to take a few minutes to get that done either now or during the summer, because it won't be available at the start of the new school year the way that it is now. So Gemma, anything more that you want to say about that process?
Oh, thank you.
All right. I will stop my share. Oh, there was one other part to the presentation today, and we're back on screen too. Here we go. And we're looking for the presentation. There it is. And really quickly, AASA released a toolkit to help increase vaccination rates because how strongly we feel about increasing vaccination rates as well. We just wanted to make sure we brought this information to you. I'm not going to go on at length about it because I do want to save time for Q&A, but these slides that we have in here just tell you a little bit more about it and have a link to it. So we just hope you find that helpful. And that's actually it for this presentation. Lauren, I know we're on the express circuit here today, so not a lot of time to take our breath and see what's in the Q&A, but wondering what pops out at you as you take a look at the questions we're getting.
Jeremiah, this might be directed towards you, but lots of questions about, could you just reiterate which tests need to be reported to DPH and when?
Yes. So that chart and number in question number 4 in the FAQ, please let us know if you have questions about that. But essentially, there's an exact overlap between which tests need to be to have a Clia waiver in place and a doctor's order in place, and then which tests need to be reported to DPH if they're positive. So if you are sending tests home, then no, you do not need to report any of those results to DPH. If a student, let's say a 16-year-old, is giving themselves the test at school, then no, you do not need to send that positive result to DPH. You do not need a Clia waiver for that, and you do not need a provider's order. However, if school staff is administering a test at school, or they're helping a student interpret the result of that test at school, this is just the CMS, the federal guidelines, then that's when you need the Clia waiver, that's when you need the doctor's order, and that's when you need to report those positives to DPH. Does that help? Or yeah.
Great. There are a lot of questions about the Clia waiver. Districts and schools that had applied for one, maybe in FY21, and then got on the statewide, and that wondering, does it just automatically extend the ones that they previously had for their own district? Will they get notification? Should they reach out to DPH? What's the best advice there?
I think it's the third one, Lauren. I will try to find out. I'm actually not sure. Not having my own Clia waiver, I'm not sure. But I tried to provide a little bit of detail on this in the chat just a moment ago. So if you asked a question about kind of what to do if you already have a Clia waiver, please just reference that text. But Lauren, I don't know if they give you a proactive heads up that it's going to expire. Okay. So for folks that are curious about that, I would reach out to DPH. Okay. But just to say that the thing that I said in the chat out loud, because there were a fair number of questions about it. If you already have a Clia waiver from previous iterations of the testing program, you can just keep on using that. If you already resubmitted your waiver or resubscribed for your waiver, then you are already done with this Clia step, and you just need to make that transition to operating under your own Clia again in September.
Great. So the contact information for the DPH Clia office is right in our FAQ. So please reference that, and you can email them and they'll get back to you. There are some questions, Russell, about our recommendations for testing next year, and if we're requiring any testing for next year.
Yeah, so at this time, we are not requiring testing for next year. And what we previously said is that if you do choose to run a testing program next year, we think that focusing on symptomatic testing makes the most sense given what we've learned about the course of the virus and, the importance of just identifying those symptomatic individuals. But it will really be up to you to decide. There's sort of no requirement from the state. We will, though, obviously continue to monitor the course of the virus. We will be back with you. We anticipate this summer, just, looking ahead to the new school year, any other advice, anything else that comes up, things change quickly with COVID. And so we're hopeful that, we'll just stay on top of any new developments, any new technologies, any new ideas that we can bring to you as recommendations for the new school year, as opposed to requirements.
Great. And then is there any information we can provide about the reporting positive results to DESE? So we know now what results need to be reported to DPH, but how about to DESE?
So we haven't discontinued our weekly reporting yet. Obviously, it's likely to wind down at the end of the school year. Anticipation of this question, I did reach out to find out, where are we going with this? And I think we're still thinking it over, so we don't have an official answer yet. So if you could continue to provide your positive reports to us for the rest of the school year. We've never reported during the summer, so our FAQ under that question about the summer says that you won't be reporting positive results to us. So it would be a change in practice if we do. I don't anticipate that. So really the question is next school year, and that's why we anticipate being back with you this summer at some point, July or early August, to talk about expectations for the new school year. So for the rest of this school year, keep reporting those positive cases. It would be a change in practice if we do it over the summer, so I'm not anticipating that, and then be ready for an announcement about the new school year.
Great. And then there have been some questions about how to order tests for next year, if they're going to be running their own testing program. We did provide a link to our statewide contract to order self-tests, and I've answered that question. I can put it again in the chat, but we do encourage people to order self-tests through our statewide contract. Any other tests that folks want to order, Jeremiah or Russell, what's our best recommendation there?
I would say be careful, be thoughtful. I know that we've, just there are a lot of great tests out there, and then there's some that, are either just hard to administer or, check those expiration dates, know what you're getting yourself into. And, we hope that, especially for self-tests, that being able to order off of our statewide contract, I think we've done a lot of that due diligence, or Jeremiah's team in particular has. And so, we're confident that you'll get some of the best of what's out there from our statewide contract. But, again, just as with everything, just be careful and thoughtful in your purchasing process.
I would agree, Russell. And just one other word of wisdom is that the marketplace for self-test right now is pretty saturated because manufacturers are still producing what they needed in January, back when it was hard to get them in January. And I say that just because the statewide contract that I just shared the link to in the chat, that's directly with manufacturers. And I would just caution folks that if you're going to go through middlemen being like medical supplies companies, just be extra careful about that, because those are folks that often don't have supply in hand in a warehouse somewhere. They have to go and find it. And that can be tricky.
Thanks, Jeremiah. Good advice.
Our questions have slowed and stalled, so I think we are good to go, Russell.
Well, I saw, and we are right at time, but I did see questions about needing stickers, and so we can follow up with CIC about that. And so if I would say if you didn't receive stickers, we appreciate what you put in the chat. Lauren, do you think people should email the testing inbox?
They can email the K-12 inbox or contact your program coordinator, and your program coordinator can work with CIC to get additional stickers sent to you.
That seems like the best solution. Contact CIC.
Well, because we'll just forward your email to CIC. So your program coordinator is your best defense.
But we'll raise this with CIC so that they know that they should expect that there are some that still need. And the question about, I appreciate the question, if you didn't get new tests for the summer, if you had enough supply on hand that you didn't order, so therefore you get stickers, of course we want you to have stickers. So we'll follow up with CIC when we meet with them tomorrow about that. Great.
And just as a reminder for everybody, these slides and the webinar recording and our FAQ are all going to be on our COVID-19 testing page on the DESE website. So please go to that in the next couple of hours and definitely by tomorrow, and you'll see this information posted there. Our FAQ
Great.
is already posted.
Right, and shared in today's chat. All right, thanks everyone. Have a good beginning to the summer, and we look forward to catching you after maybe a little bit of a chance to rejuvenate, and we'll be back together late July, early August. Have a good day.